So I want to try a little experiment with you.
Okay, I'm in.
Picture a timeline of human history in your head. Scroll back. Past the iPhone, past the World Wars, past the Industrial Revolution, the Renaissance, the Crusades, all the way back to the Roman Empire. And then, just keep going a few more centuries.
We're landing somewhere around, what, 600 BCE?
Exactly, 600 BCE.
Yeah.
And to give you some context, this is a time when Athens is just starting to figure out democracy.
Right. Rome is basically still a swampy village at this point.
And most of the world is using bronze tools and, just trying not to die from a tooth infection.
It's a time we generally think of as superstitious, very rudimentary.
And yet, if you were in the ancient city of Kashi, what we now call Varanasi in India, you could potentially witness a man performing a complex plastic surgery.
Reconstructing a nose, for instance.
Or removing a cataract from an eye. Or even, and this is wild, performing a C-section to save a baby.
It sounds like a glitch in the simulation, doesn't it?
It totally does.
Like somebody pasted a modern hospital scene into an ancient history textbook.
That is exactly what we are unpacking today. We are doing a deep dive into the life and really the legacy of Sushruta.
The father of surgery.
Right. But even that title, I feel like it only undersells it. This isn't just a guy who, clean wins better than the next guy.
No. We are talking about a level of surgical sophistication that Western medicine wouldn't even come close to for nearly 2,000 years.
It just forces you to confront this chronological snobbery we all have.
Oh, absolutely. We think ancient automatically means primitive.
Yeah.
But Sushruta is exhibit A that human ingenuity, specifically scientific ingenuity, was peaking in places we often just overlook.
So let's set the scene. Kashi, 600 BCE. Who is this guy, Sushruta? Is he a priest?
Yeah.
A doctor? A kind of wizard?
Well, back then those lines were a little blurry. Kashi was this huge cultural and spiritual capital, and Sushruta belonged to a lineage of healers called the Dhanvantari school. And this part is crucial. In their tradition, medicine wasn't just a trade. It was a yajna, a kind of sacred offering.
So it was religious then?
Yes, but not in the way we might think. It wasn't just pray and hope the gods fix the broken leg.
Right.
It was where spirituality met rigorous empiricism. They believed the physician was a servant of the divine. But the way you served was by understanding the physical reality of the body perfectly.
It's like saying, God built this incredibly complex machine, so it's my holy duty to figure out exactly how all the gears turn.
That is a beautiful way to put it. And he didn't just keep this knowledge in his head. He compiled it all into the Sushruta Samhita.
Which is not just a textbook. I looked at the stats on this thing. It is massive.
Oh, it's an encyclopedia, a true compendium.
Yeah.
It's 186 chapters organized into 6 books, or sthanas.
And it covers everything.
Everything. The Sutra Sthana lays out the basic principles, but then you get these deep dives into pathology, anatomy, toxicology, even pediatrics.
The toxicology part really stood out to me. He's dealing with snake bites and poisons right alongside open surgery. But I'm curious about the framework. I know in ancient Greece you had the 4 humors. Did Sushruta have a theory for why the body gets sick?
He did. It's the Tridosha theory, Vata, Pitta, and Kapha. These 3 humors or energies that govern our physiology.
Okay.
Now, modern medicine has obviously moved past that, but here's why it was so important for surgery. Sushruta believed you couldn't just cut a person open whenever you felt like it.
You had to look at the whole system, not just the wound.
Precisely. You had to understand their whole constitution. If the humors were aggravated, maybe you'd delay the surgery or change their diet to balance them first. It was a holistic risk assessment.
Okay, that brings us to what I think is the biggest hurdle for a surgeon in 600 BCE.
Anatomy.
Anatomy. To fix the machine, you need the map. But they didn't have formaldehyde, no refrigeration. How on earth did he learn it?
This is where Sushruta gets incredibly inventive. And frankly, a little brave. You have to remember, in ancient Hindu society, touching a dead body was a huge taboo, ritually polluting.
Right, so society is telling you, don't touch the dead, but your profession is demanding you must look inside the dead to save the living.
Exactly the conflict. So he had to find a loophole. A way to study the body without technically dissecting it with a knife in that violent sense.
And this is the river basket method.
Right.
Right. I read about this and I honestly had to just pause and think about it.
That's the one. Walk us through it.
So he would take a cadaver, someone who hadn't died of poison or a chronic disease, so the body was normal. He'd remove the intestines. Then he'd wrap the body in grass or put it in a wicker basket. And then he would submerge this whole thing in a gently flowing river for 7 days.
Wait, hang on. If I leave a piece of meat in water for a week, doesn't it just bloat up and rot? How does that help you see anything?
That's what you'd think. But it's a very delicate balance. The goal wasn't preservation, it was maceration.
So the cool flowing water would soften all the tissues.
Right. Without completely destroying the structure of the muscles and the vessels, it just loosened everything up.
So after 7 days, he pulls it out of the river, and then what?
He wouldn't use a knife. He would take these brushes made of roots or hair or bamboo, and he would just gently scrub the body.
He scrubbed the skin off.
Essentially, yeah, layer by layer. And as he brushed away the softened skin and fat, the underlying structures, muscles, arteries, ligaments, they would reveal themselves.
That is visceral, but I totally see the logic.
Me too.
If you cut with a knife, you might slice a nerve and never even know it was there.
But if you brush the tissue away, the nerve stays intact. It's kind of non-destructive dissection.
Wow. And because of this, Sushruta identified over 300 bones, and he was thorough, counting teeth and nails.
Close, what, 700 vessels, 500 muscles?
It's staggering accuracy for the time. I mean, compare that to Galen, the giant of Western medicine, who came centuries later.
Galen was dissecting pigs, right?
Pigs and monkeys, because human dissection was illegal in Rome. His maps of the human body were actually maps of animals. Sushruta was looking at the real thing.
So he's got the map. Now let's talk about the gear. Because you can't perform surgery with your bare hand.
No, you cannot.
And the Sushruta Samhita lists this toolbox that just sounds modern.
It really does. He lists over 120 surgical instruments, the Shastra Yantra, and they were made of iron, often tempered to be almost like steel.
I saw scalpels, saws, catheters.
Yeah.
But what caught my eye was the naming. They're named after animals.
Many of them, yeah. And it wasn't just poetic, it was functional. For instance, he had forceps called Simamukha Yantra, the lion's face.
Lion's face. Okay, so that implies a really strong grip.
Exactly. It was a heavy-duty forceps for pulling out arrowheads or bone fragments. Then you had others shaped like a heron's beak or a crocodile's mouth.
So the shape of the animal's head literally dictated the function of the tool.
And the ergonomics, the grip angle, the leverage, it was pure functional engineering.
Okay, so we have the map, we have the tools. Now we get to the part that really creates the legend, the surgeries. And the one everyone talks about, the one that seems impossible for 600 BCE, is the nose job.
Rhinoplasty. Nasa Santana.
But we should clarify, this wasn't about vanity, was it?
Oh, no, not at all. The context is actually quite grim. In ancient India, cutting off someone's nose was a standard punishment for things like adultery or theft.
And it was a common injury in war, too. So you have people walking around with, a hole in their face.
Which was a living death. You were a total outcast. So this procedure was reconstructive. It was about restoring dignity. And the technique he invented is the direct ancestor of modern plastic surgery.
Okay, walk us through it. How do you build a nose from scratch in the Iron Age?
So first, he'd measure the missing part of the nose with a leaf, like a template. Then he'd go to the patient's cheek.
He cuts a patch of skin from their cheek.
He cuts a flap of skin, but, and this is the absolute genius of it, he doesn't cut it all the way off. He leaves a small strip of tissue attached, a pedicle.
Why? What does that do?
It keeps the blood supply connected. If he cut it off completely, the skin would just die. It has to be alive. So he twists this living flap of skin and rotates it over the nose area.
But wait, if you just slap a piece of skin there, how does the patient breathe?
Good question. You need nostrils.
Right.
So Sushruta would insert 2 hollow stalks from a castor oil plant, basically reed tubes to act as stents. He'd drape the skin over these tubes to form the nostrils, stitch it in place, and apply medicinal powders to prevent infection.
That is unbelievable. He's doing a complex tissue transfer with structural engineering.
It's a pedicle flap graft. It is technically difficult even today.
And it wasn't just noses. He was operating on eyes, too.
Yes, cataract surgery. A procedure called couching.
Okay.
So today we use lasers to break up the cloudy lens and replace it. Sushruta couldn't replace it. So he used a curved needle, a Jabamukhi salaka, to pierce the eye.
Oh, wow.
And he would gently push the clouded lens backward, out of the line of sight, down into the vitreous jelly of the eye.
So the lens is still in there, just at the bottom.
Exactly. It's not a perfect solution by modern standards, but think about it. You're totally blind. Then this doctor pokes a needle in your eye, and suddenly you can see light and shapes again. It must have felt like a miracle.
I want to touch on one more procedure, the C-section. Because for us, it's pretty routine. But for him, it was a very different situation.
Very different. He only describes it as a salvage operation. It was only performed if the mother had already died during labor or was clearly dying. The goal was only to save the baby.
That's heartbreaking. But it shows he understood the limits. He wasn't a cowboy.
No, he was trying to snatch one life from the jaws of death.
You mentioned the needle in the eye, and I think every listener is probably cringing right now. What about the pain? Did they just bite down on a stick?
I'm glad you asked, because that's a huge myth. Sushruta was a master pharmacist. He used formulations called Samahini and Sangiovini.
And what was in them?
Well, it was a potent cocktail. Wine was the base, but it was infused with cannabis and datura.
Datura. Isn't that a powerful hallucinogen?
It is a deliriant. But in the right dose, it's a heavy sedative. It dissociates the patient from the pain. They weren't under like we think of it, but they were sedated enough that they likely wouldn't remember the trauma.
So he knocks them out, does the surgery. But in a world without antibiotics, how do they not all die of sepsis 3 days later?
This is where his concept of vrana, or wound care, was so advanced. He distinguished between shahana, cleansing the wound, and ropana, healing the wound.
Which sounds a lot like how we talk about inflammation and tissue proliferation today.
Exactly. He used antiseptic herbal pastes neem, turmeric, sesame. He insisted on extreme cleanliness. He was practicing microbiology without even knowing what microbes were.
Hearing about the precision required, twisting skin flaps, pushing on a lens. It makes me wonder about the training. You can't just read a book and then go try this.
No, and Sushruta would have failed you if you did. He was huge on simulation training. He said a surgeon needed hands that do not tremble.
High bar. So how do you train for that without practicing on people?
You practice on vegetables.
Vegetables.
Seriously.
Yeah.
To practice making incisions, you'd use gourds and watermelons. They have a rind and flesh that mimics skin.
Okay, I can see that.
But here's the brilliant one. To practice puncturing a vein or excising a tumor, you'd practice on lotus stalks.
Lotus stalks. Because they're hollow.
They're hollow, they're fibrous, and they are incredibly delicate. If you press too hard, you crush it. Not hard enough, you don't cut. It teaches you the exact tactile pressure you need.
That is genius. It's like a flight simulator for surgeons.
It was a whole progressive curriculum.
Yeah.
You watched, you practiced on cucumbers, you assisted, and only then, when your hand was steady, did you touch a patient.
So we have this incredible body of knowledge in India, 600 BCE. How did we get from there to here? Because I definitely didn't learn about Sushruta in school. I learned about Hippocrates.
Well, the knowledge traveled. The Silk Road was an information superhighway. His texts were translated into Arabic during the Islamic Golden Age. But there's a very specific story about how the West rediscovered the nose job. And it involves a man named Khawasji.
Khawasji. Who was he?
So we jump forward to 1794. The British are in India. Khawasji was a bullock cart driver working for the British. He gets captured by an opposing sultan's forces, and they cut off his nose and one of his hands.
The standard punishment again.
Right. He survives, but he's mutilated. But then he hears about a bricklayer. Sometimes it's a potter in the city of Pune who knows the ancient art.
Wait, a bricklayer? Not a doctor.
This is the fascinating part. Over the centuries, these surgical skills were preserved by the lower castes, the potters, the barbers. They kept the hands-on tradition alive.
So Khawasji goes to this man.
He does, and 2 British surgeons tag along to watch.
And they see the whole forehead flap procedure.
The whole thing, the flap from the forehead, the reed tubes, the turmeric paste, they are absolutely stunned. They document it and send a report back to the Gentleman's Magazine in London.
And that's the spark.
That's the spark. A British surgeon named Joseph Constantine Carpew sees it, spends years practicing on cadavers, and in 1815 performs the first Indian method, rhinoplasty, in England.
Wow. Did he give credit? Or did he try to call it the Carpew method?
Surprisingly, he was very open about it. He called it the Indian method. He acknowledged that the East was light years ahead. And that moment is basically the birth of modern plastic surgery in the West.
It's just wild to think that a nose job in Beverly Hills today is a direct descendant of a text written in Sanskrit 2,600 years ago.
Preserved by potters and demonstrated on a bullock cart driver.
It connects us all. So bringing it back home, we have lasers, robots, AI. Is Sushruta just a history lesson? Or there's something we're missing that he had?
I think it's his philosophy. For Sushruta, the patient wasn't just a broken car. It was about treating the mind, the body, the lifestyle, and the ethics. He had a saying, Vaidyo Narayana Hari.
The physician is God.
More like, the physician is like God, or a servant of God. It wasn't about ego. It meant that because you're dealing with life, which is divine, you have a moral duty to be excellent.
You can't be mediocre. You can't have a trembling hand.
So you have to care.
I feel like in our modern system, where doctors have 15 minutes per patient and spend half of it on a computer, we might have lost a bit of that sacred duty vibe.
We might have. Sushruta reminds us that medicine is, yes, a technical art, but fundamentally it's an act of compassion.
I want to leave everyone with a thought. We often look back and think, wow, look how far we've come. But when you look at Sushruta, you realize that sometimes we spend centuries fumbling in the dark, trying to reinvent a wheel that was already rolling perfectly in 600 BCE.
It really makes you wonder what else is sitting in a dusty library somewhere, just waiting to be rediscovered.
Exactly. Keep digging, everyone. We'll see you on the next deep dive.